can always bring it up in the health coaching session. So thank you.
Okay. Thank you, Heather.
Thanks. And I think we have Dr. Chan on now. Hi, Dr. Chan.
Mhm.
How are you? Thank you very much. So, Heather, how long will you be here for? Are you leaving?
I can stay
Soon,
for a
right?
few.
Yeah, okay. So the purpose for me doing this is to really, stay more engaged with, all of you guys and, be able to answer any general questions that you may have. Right, so this is meant to be for you. Is one way to enhance communication between me and you. So it's all yours. I have no time limit, right? So ask me anything that you think that might be pertinent, important, anything.
Well, Dr. Chan, it's Faith. We were just talking about the breathing in and out. Breathing in through your nose and out through your nose versus breathing in through your nose and out through your mouth. And she said you like to put your tongue on the roof of your mouth, and I'm wondering why.
Yes. Okay, so I would also, sometimes I can write in here. In many ancient cultures, if you believe in, right, many that include Chinese and also Indian Ayurvedic medicine. And they believe that in order to connect, if you believe in it now, this is more, out there, right? For those of us who practice this type of exercise, oftentimes we call that qigong exercises, right? And in order, and one of the purpose of doing qigong is to what? Is to open up meridians. Right? What are meridians? Meridians are believed to be energy channels inside the body. So again, right, I cannot prove that is what they believe in. And in order to connect and open up the meridians, you have to do two things, right? Where most people don't do, right, correctly. Number one is to do that, right? Touch the tongue with your palate, right? Touch the tongue with your palates, right? And then second, which is more gross, but that's what we were taught to do, is to tighten, right, the anal sphincter. Right? Yes, and seasoned qigong practitioner will do both, right? They will touch the top of the tongue with the palate, right, and tighten the sphincter to connect the channel. Right, and before they do those breathing exercises, is it really important? I don't know, but people who are serious about this will say, oh yeah, it's important if you want to be more beneficial. So, but again, I think as long as you're doing some exercises nowadays or breathing, I think it's good, right? Whether or not you have to do it like that, I think is highly individualized.
Okay, thank you.
I hope that helps. But yes, but if you're serious about qigong practice, you do both. And the third thing would be after the end, and when you touch the palate with your tongue, what happens is you start to accumulate your saliva, and you can try that on your own. Did I spell correctly? Yes, right. And that saliva is meant to be, we call that the essence, right? Or in Chinese, we call that Jing, J-I-N-G, which represent the essence of your energy. And so you're supposed to hold that, right? Because as you touch your tongue to the top of your palate, you will start to slowly accumulate your saliva, and you're not supposed to swallow it, right? Unless you have a lot, right? But that tiny little bit, we want to save until the end, and then you swallow. And then as you swallow, you're supposed to imagine, right? Like we call that create a visual or visualize, right? Visualize, right? That essence descending into your lower abdomen area. Right, the lower abdomen area, we call that dantian, D-E-N-T-I-E-N in Chinese, right? And that is the lower burner, where we call that, or the lower energy area, or similar to the second chakra. If you believe in Eastern medicine, especially Ayurveda, right? We have the chakra, and depending on who you talk to, we have identified at least 8 chakras, right? Some people say 7, is actually 8. And sorry, there's no N, chakras, not chankras, sorry. I'm too into my last name, right? Sorry. So it's chakra, no, there's no N. And so the second chakra, right? The second chakra, KRA actually, right, is what I'm talking about here, the lower abdominal area where you collect that chi. Sorry, where you collect that chi energy, right, for storage, right? Because one way to slow down aging process, if you believe the other cultures, is we want to preserve, right? Preserve as much as we have. And one way to preserve your energy, right, is to protect your essence, right? By practicing this type of exercises, right? Swallowing your saliva, and imagine going down to your lower abdomen is a storage, right? Storing your essence, like preserving. So a lot of practices that we do in age management medicine or anti-aging is to preserve, right? What we have, preserve, right? You know, our energy. And so those are really is the essence of Qigong exercise. What are we doing? Why am I doing those breathing exercises, right? Is to really collect your Qi or essence, right? To preserve, to give you that additional resources, right? What are we collecting? Is the resource, right? We call that the health bank account. That's what we are doing.
Okay,
right?
well,
Which is
thank you.
different.
Yeah, got it.
Okay, am I speaking? Sorry.
I don't know.
Okay.
I mean, you know, I'm interested in that stuff. I don't know about everybody else on the call, so.
Good. So in
monopolize.
essence, but I want everyone to know that all we are doing, right, is to preserve your health bank account, right? Which is very different than conventional medicine, which is to intervene when there's a problem,
Mhm,
right? That's the distinction.
mhm.
I have a question. May I ask a question?
Yeah,
Barbara
please,
Mishler.
please.
Yes, you in an email some time ago recommended taking magnesium threonate.
Yes.
And I
Yeah.
finished my first bottle. Is this something you recommend that we continue?
Yeah, well, it depends, right? We can at least measure. First, I would like to measure at least your magnesium in the blood. Although we know that measure magnesium in the blood is not completely accurate, because magnesium, like B12, is one of those that whatever you see in the blood may not always represent what is in the cell, right? In particular, sometimes we will do red blood cell analysis, right, to measure magnesium, for example. So depending on what magnesium we need for, right? For example, most people think of, oh, I just need magnesium for my bowel, right? Because I have constipation, so I need magnesium. And that's true, right? But there's only one form of magnesium, right? Usually we're talking about magnesium oxide or glycinate. I want to make sure I spell correctly in the chat box, right? But there's so many more, right? So when you're talking about threonate, it has more to do with sleep, right? So if we want to calm down my brain, because if the brain is too excited and we would like to have magnesium to slow down the brain and not get too excited, then we want magnesium threonate. And depending on, like, for example, another popular concern is I have restless leg syndrome and I have muscle aches. So what do I usually tell my patient? I said, you need magnesium malate, right? Malate is the form of magnesium that are specifically targeted for muscle, right? And another form is I always tell my patient to use Epsom salt, right? Bath. Why? Because Epsom salt is nothing more than magnesium sulfate, right? Which is another good source for the skin and the muscle for relaxation. So in conclusion, depending on what type of magnesium we need or condition we need, we will need different type of magnesium. And in general, yes, magnesium is very safe. It's not something like, oh my gosh, the window of magnesium is very safe. So you can take a lot, right? And unless you do like this, otherwise, no, there will not be a problem, right? So again, if your problem is sleep, then magnesium threonate would be something, right? If the problem is concentration, then for example, we might talk about magnesium taurine, right? Which is another form of magnesium. So depending on what condition, right, we will use different type of magnesium. I hope I'm not. If please tell me if I say too much, because I tend to give you everything when you ask a question.
Thank you.
Well, you said something about magnesium for sleep. Can you repeat what that was?
Yes, that would be threonate.
Spell it.
Right here. I may be wrong, forgive me, but I'll look it up.
Threonate. Okay. Oh,
Yeah, depending on the product, sometimes you will say theanine.
It has an R in it, THROEONATE.
Okay, thank you. So can I blame? Like I can always blame, right? Oh, English is not my first language. So I can always cover, right? Now.
Right. Well, I take magnesium for the cramping in my legs. Take calm.
Well, there is one that I just recently used. In fact, I also started to use that in my office in Phoenix. Is a combination of different magnesium. I have not seen those, so it's the first time I saw a very well balanced magnesium formulation. So I have been recommending that now to many patients.
Good, that's good.
But you're right, magnesium is probably, no, it's not. It is for sure the number one mineral deficiency we have in our population, right? And without magnesium, right, you're much more likely to have muscle tightness, muscle spasm, restless leg syndrome, and what else? Arrhythmia, right? Many doctors believe that when you don't have enough magnesium, right, among other things, you're much more likely to develop AFIB, which is very common in this population.
Oh.
So yeah, now don't get me wrong, I'm not, right?
Magnesium supplement?
We could. In fact, some studies have shown that, if at least I have, in my experience in the past, oh my gosh, I have two patients actually, who has been seeing a cardiologist for more than 10 years, right, and on Coumadin. And I just checked their labs. And what do I check? Right, some of you know this, I check their homocysteine, right? And the homocysteine is a test that Dr. Morris sometimes check. And homocysteine is a test I check in my Restore You panel. Some of you may have done that already for the brain health. And homocysteine is a measurement of how well we can use B12. So I have two patients so far that I just happened to give them B12. And miraculously, the AFib is gone. So he even actually designed a website to say that. So now, don't get me wrong, please, I am not saying that B12 cure AFib, nor magnesium, no. But the reality is, for those patients who has AFib, but for some reason, if I also identify that they have an underlying deficiency of magnesium or B12, right? And in this case, B12, they got better. So remember, again, right, there are different causes. We know that arrhythmia in general, right, could be caused by magnesium deficiency, B12 deficiency, potassium, and progesterone deficiency. So they all got the same outcome. They all have arrhythmia. So yes, in conventional medicine, we just treat the symptom with a beta blocker or a calcium channel blocker. I block it, sure. But we never really find the cause. Why are you having arrhythmia? Is it because of magnesium deficiency? Or is it because of potassium, progesterone? Oh, one more, fish oil, omega-3, right? It's also because omega-3 fatty acids, fish oil, it stabilizes cell membrane. We call that membrane stabilizer, right? It stabilizes cell membrane so that it's not going to get excited too easily, including your heart cells. So there are studies that show that, oh my gosh, appropriate use of fish oil can also improve arrhythmia. So how do I know who needs that? It depends, right? The blood test will tell me what type of deficiency you most likely have.
Well, and that can
And then you
affect
treat the cause.
like my blood pressure's been sort of, up and down. And so maybe I am deficient in something.
Yes, and yes, and we can test for that. In fact, there are other tests that I would love to offer as we evolve. Micronutrient testing, right? And that can also test, but those are beyond what we do. Like as some of you know already, I am already above and beyond most labs that Dr. Morse used to do. If I start to do micronutrient testing, now that is now even further away from conventional medicine, and we now step into the problem with insurance coverage, right? That's why I don't do it, all the time. When if patients are asking for it, then I will talk about it, right? But in general, I don't do it because insurance don't pay for it.
I get it.
Yeah, I try to maximize what insurance can pay for and see if I can get my patient to be healthier, right? And that includes my allergy testing. Why are we doing that? Because that's the only test I know that can identify underlying inflammation that is covered by insurance. Right? I will always do what insurance covers first and try to maximize what we can get before we tap into non-insurance services.
I get it. I was wondering about that actually, why you were doing that. Yeah.
So can you do these tests in your office for all the deficiencies, mineral and vitamins and things like that?
Yeah. The company I use down in Phoenix is called SpectraCell. Right, and so and micronutrient testing. Another lab I use is called Genova, right? And they also do other type of nutrition testing. So for those patients who are interested to go above and beyond, right? Once again, like I said, conventional medicine focus on treating the tip of the iceberg. Whatever I see above the ocean, I see an iceberg above the ocean, I treat it. But we don't care beneath the ocean. So if I start to want to look at what's underneath the ocean, then I have to go deeper with other type of testing. And so we could do that. Yeah, it now becomes more personalized.
Yeah.
Right. I don't say, oh, everyone should do it. No, it really depends on the patient.
Okay, excellent. Thank you.
Well, I if nobody else has a question, I have another one. You're a trained acupuncturist?
Yes, we call that medical for doctors, for medical acupuncture. Yes.
Are you offering it in your practice?
I don't know. I would love to, for sure, especially when I start to do, again, I was told that I am too fast. So I purposely withhold something I'm trying to do. No, seriously, right? I was like, okay, right? I mean, we are a different population here. Please slow down, right? And, slowly. So I said, okay. So first, let me start with protecting the brain and then the heart. And then soon I am offering to protect the muscle, right? Because I know that, I mean, everything I'm trying to do, right, is trying to maximize independence and hopefully minimize our chance of going to nursing home, right? And to do that, no offense, to do like Western medicine is very good at preparing patients to go to nursing home. My job is not to prepare you to go nursing home. Hopefully and ideally, my job is to prevent you from going to nursing homes. So to do that, right, we have to protect the brain, dementia, heart attack, because heart attack remains the number one killer. And also your muscle, right? As we lose our muscle, we will start to lose our balance and much more likely to fall. And if we fall, then we get fractures. If we get fractures, that equals to nursing home for many people, right? And also, if I don't have enough muscle, I cannot exercise. And we know exercise is extremely important for both the brain and the heart. So those are three things I am doing now, right? But then in the next few months, I think in the summertime, I would like to start offering joint injections.
What about acupuncture? That's what I was asking about.
Yeah, I'm coming. And oftentimes with joint injections, I am going to add acupuncture on the regimen.
Oh, we've lost your sound.
Oh, you lost me?
Oh, I hear you.
Okay. I'm sorry. I repeat what I said.
Okay.
So I will be, yes. So when I start offering joint injections, especially using, not using steroid, I am not about using cortisone shot, because I know cortisone, even though it could help your symptoms, but it destroyed the joint even more. And that is a very delicate thing to do for this population, because your joints are already damaged. If I keep injecting with cortisone, even though your pain may get better, but I'm destroying your joint further, making sure that you need surgery, right? If I keep giving cortisone shots in your population, I guarantee I am having you to do shoulder or hip or knee surgery.
So the
when
reason I asked you that question about acupuncture is because Stuart, my husband, has a lot of Meniere's symptoms. He has ringing and vertigo, and he does get effect from acupuncture.
Yes,
It's
so
one
thank you
thing
for
I know
clarifying.
that helps him. So that's why I was asking him.
Yeah. And when I start to do acupuncture initially, thank you, I will focus the acupuncture for pain management purpose, because that's where acupuncture works the most. In fact, in some area, acupuncture is quite magical when it comes to pain management. For other condition though, what you call now functional disorders, like ringing in the ear or vertigo, acupuncture still work, but not as well as pain management. And it takes a lot more sessions to do. So that I probably won't have time. And so I will continue to refer patient to acupuncturist.
Yeah.
So to answer your question, will I start doing acupuncture? Yes, but I will probably focus acupuncture on pain management together with joint injections. So.
Okay.
Dr. Chan?
Yes, ma'am.
Hi, I was wondering, who do you recommend the shingles vaccine for? Is there a particular population, or do you recommend it for everyone, or? Or
Yeah,
you don't
I-
recommend it at all?
No, I do. I do. I do. In general, anyone above 50, nowadays, I will do that.
Okay. And do you
Yes,
have
because
a
now
recommendation that there was one initially and then now there's a two
Yes,
injection?
yes. In
If
fact,
we
those
got the
who,
first, do you recommend the getting the second one because it's more
yes, I
effective?
do.
You do.
I do
Okay.
because I would say that it is less controversial than COVID vaccine, number one. Number two, I would say that I have seen many patients with, as you know, right, with a neuralgia, right, post-herpetic neuralgia, right? That's the term we use for shingles-related pain, and that is very painful, right? And oftentimes is not well treated, so it's better to prevent, right? So yes, I will recommend shingle vaccines, the new version nowadays. Yes,
Thank you.
no problem.
Dr. Chan, what,
ma'am.
yeah, I was just interested in different types of exercises for cardio. Would a treadmill be a good idea for that?
It depends, right? Again, I don't remember, right? But for those, again, let me say general, right? I don't want to be, when it's public. So in general, right, depending on your cardiac and pulmonary condition, depending on your heart and your lung function. If let's say that no, my heart and my lung is great, then yes, absolutely, right? But many patients may not have the stamina, right? So then, I would always recommend lighter exercises,
Right, okay,
especially those who may have heart or lung issues,
yeah,
right?
sure,
Then we have to be gentle. And
sure.
that is a question for Heather because she
Yes,
is
yes,
this area.
that's true.
Which is
Okay,
why I really like this office because this is the only office that has an in-house health coach
yeah,
that can help me to help you to get healthier.
okay. Thank you.
No problem. Anything else? Let me share with you something new, right? Oh, sorry, maybe too fast, right? So, no, in fact, I want you to know that very soon, I think we're working on it. We are going to start having mobile from Balami blood draw, right? So I'm going to now have, I think, right, very soon we will formally announce that many patients otherwise who don't want to travel or to my office, I can send somebody to come to your house and do blood work. And I hope the next step would be, and some of you want it, I know some of you may want that, would be once I secure a company who can do mobile from Balami for me, then the next step is to offer mobile IVs, right, in your home, because I know that that would be something also beneficial. Many patients may not want to go to the ER. I know that. So I'm trying to find a way to come to you, right? So if I can find a mobile nurse, which I'm working on it, that can also come to your house, we can start to do little things to make sure that to do the right triage, to make sure that you're stable enough not to have to go to ER. And number two, I can also start to give you IV fluids at home. So that's something we are working on as we speak. It's coming.
That's good.
Yeah, because I also noticed that as of yesterday, in case you don't know, Yavapai Medical Center has dropped Blue Cross Blue Shield. So, so please, if you are using any specialist, if you have Blue Cross Blue Shield, you need to make sure that your doctors are taking Blue Cross because many specialists in here up north are affiliated with Yavapai and they may not be taking Blue Cross anymore. So I can see that already happening. that more and more patients are coming down to Phoenix to see specialists. So that would be good because I can help, right? I can help coordinate better, right? To help my patients see specialists in here. And I'm also working, hopefully, to find a way to improve transport, because many of you also told me that you guys cannot drive or don't want to drive down to Phoenix. So I hope that I can also offer that. I'm working on it as well, right? If I can find a mobile phlebotomist and a mobile nurse, I probably will be able to find a mobile way to transport my patient to come to Phoenix for their specialty appointment, but without having to drive. So that's one thing I'm working on as well. So stay tuned.
Oh, thank you. That sounds
So,
great.
yeah, because no one else is doing that up north.
That's right.
And I have this advantage because I have another location in here, right? And I have seen more and more patients now who are snowbirds, right? You have a house up north and also a home in Phoenix. So you can still see me here in my office, but you can always see me on telly like now, but I can see you in my office in Phoenix, right? And help coordinate care, right? So we'll see how that evolves.
So if there's still time, I have one more question about going to see a cardiologist, which is where you sent me for the next step. This is Faith. And so how do we get a cardiologist on board? In other words, you're talking about there's some other things that can be like the testing to see what deficiencies there are. I mean, my experience with cardiologists is they don't do that.
They don't. So, and I don't want to say too much about your personal medical history. So
Okay.
again, I will stick in general.
Right.
In general, Dr. Chen, why the heck you sent me to specialists in the first place? Most of the time is to establish a further diagnosis to find out, okay, what else can we do from a conventional standpoint, right, to address a particular problem, right? To have a specialist to also be, looking at you, right? But that is the medical side, right? Yeah, you're right. They will focus on, well, is there any other conventional test I can do? Maybe there's other medications I don't know about because I am not a cardiologist. Maybe there's some procedures that they do, right, that I don't know about. So it's more for that. But then I always want the patient come back and say, okay, now that we have seen the specialist, and oftentimes they may not be able to do anything more than we can do now, then that's where I shine, right? Once I have all my patients see the specialist and they say, well, sorry, there's not much I can do anymore, go back to your primary. That's where I start to focus on what can I do now to help you to get healthier. This is where I start measuring more of your nutrient, your nutrition, your hormones, things like that, because these are the things that they would not do, right? But I would typically do that after I send you to the specialist and do what the Western medicine has to offer first, right? Why? Because that's what your insurance requires, and that's what my license requires. You have to send the patient to do all the Western medicine has to offer first. Once you exhausted that, now you can come back and say, okay, what can I do to get you healthier, right? And the underlying things is always about nutrition and hormonal deficiency. And once we improve that, oftentimes patient quality of life improve.
Mhm. Good.
So that's what I'm
Like your
trying to do.
answer.
Sorry. So I hope that helps.
Yeah, it does, actually. It does. Yeah, I don't have
Yeah.
any more questions. Thank you.
sorry, let me finish this first. So I apologize. My office manager just come ask a question, but anyway, yes, we may continue.
I don't have any more questions, Dr. Chan. Thank you.
Good, good. I apologize for everyone else. I don't mean that to be a, you're welcome to ask questions, right? I mean, so.
Dr. Chan,
Yes.
what is the Restore You panel?
The Restore
What is-
You panel.
Yeah.
Yeah. The Restore You is a, how do I explain that? There's a company called U Method. Was founded by a doctor who is now working with Quest, right? The lab on a national scale, on a national basis, which is why it is endorsed by Medicare, right? So only Medicare patient can do it, right? Would be paid for by Medicare. It's a collaborative effort between U Method, the company, and Quest, right, to measure important brain chemistry that would tell me your risk for developing dementia. It is pretty much built upon what Dr. Morris has already been doing. So I would say Dr. Morris' panel, I call that the Morris panel, right, is about 1/3 of what U Restore measures. So what else does U Restore measure that Dr. Morris panel does not measure? That include different type of hormones and nutrients, once again, right? So in particular, right, would be certain hormones. I'll share with you if you don't mind, right? Would be, of course, the female hormones. Females' hormones are estrogen, progesterone, and they'll also measure testosterone, DHEA, cortisol, and perhaps the most important hormone is what is called pregnenolone. Pregnenolone is known as the brain hormone. When pregnenolone is low, we are much more likely to develop dementia. Oh, one more hormone, of course, thyroid, right? Thyroid is, even though Dr. Morris already measured it, right? But in particular, we are looking at T3, right? Not just T4. I hope I'm not putting you guys to sleep, right? But again, there are two major thyroid hormones, T4 and T3. Most doctors only measure T4. Why? Because T4 is what? Is synthroid, right? T4 is levothyroxine. Cannot type levothyroxine. So that is what most doctors measure. But what most doctors don't say is T4 actually produces, let me do this here, produces T3. And T3 is what is important, not T4. T4 is just a precursor, right? 20% of your body metabolism is controlled by T4, but 80% is by T3. And so I always measure T3, not just T4, because just because I give you levothyroxine doesn't always mean you make T3. As we get older, or as you know, I don't say that, I say as we get more mature, our ability to convert, right, goes down. So we no longer convert T4 to T3 adequately. So we measure that to make sure that, even though you may be taking levothyroxine, then I know it will improve your T4, but it doesn't always improve your T3. And T3 is what is important to prevent dementia, which is also what we measure in U Restore. So I hope I didn't confuse you, but right. So if you still have questions, I'll be more than happy to talk to you when you come to do your blood work, right? And I'll always tell my patient about the difference between T4 and T3. T4 is levothyroxine. We need T4 to make T3, but we don't always make enough T3 as we get more mature. And without T3, I get brain fog. I get tired. I'm much more likely to have dementia. Oh, one more thing, right? My cholesterol will be higher, right? One of the important thing is when, and most doctors don't say that, don't tell you. They don't, right? Maybe they forgot. When your T3 drops, your LDL cholesterol goes up. So when patient asks, Dr. Chan, why does my cholesterol go up as I get older? One important reason is because your thyroid drop. As my T3 drop, then my bad cholesterol goes up. That's why. I hope I'm not saying too much. Are we okay here? Oops, I think you're muted. I cannot
Yeah.
hear you.
Very useful information. Thank you.
Good. I
Yeah.
apologize if I love to teach, as you know. In fact,
Yeah.
the word doctor means teacher, right? So I believe in education, but sometimes I can go too far. So forgive me if I overwhelm you.
This has been very wonderful. Thank you so much, Doctor.
No, yeah, please let us know, because I know that I took over from Dr. Morris, right? And I try to always improve on what I can do, and I know I'm not perfect. So this is one way for me to say, okay, right? If there's anything else I can help, please let me know. And I said, you know what? Every week I am going to have a session like this, right? To answer anything. That I may not have a chance to talk to you in your individual appointment. Maybe you forgot, maybe I forgot, right? And so you know, anything I can do to help, please let me know.
Thank you.
Okay.
Thank you very much.
Okay. Well, if nothing else, I will see you in the office, or I will see you next week on a session like this. Okay.
Thank you.
Okay.
Dr. Chan, you're an amazing doctor.
You bet
Oh,
you
thank you.
are. Bye-bye.
I can
Bye-bye.
always do better.
Thank you.
Thank you.